I recently talked about the show code, which is when someone is in cardiac arrest and they are not a candidate for resuscitation, we perform a resuscitation anyway, usually because of some sort of public perception issue. My stance was that we should not be performing show codes. That if a person is not a candidate for resuscitation, then we simply don't perform a resuscitation. In fact, one of the worst things that could happen in a show code is we actually get a pulse back, which extends the suffering of the patient and of their family. But a lot of people refer to the skills code during this discussion, which is another inappropriate type of resuscitation. In a skills code, we have a patient who is not a candidate for resuscitation, but we perform a resuscitation anyway so that providers can get their hands on skills that they've never performed before or only perform infrequently so that they can get exposure and maintain competency. Here's the problem. This is actually a violation of our professional ethics. A person who is in cardiac arrest who is not considered a candidate for resuscitation is for all intents and purposes considered to be deceased. Their implied consent also ceases at this time and does not extend to being used as a cadaver. And family consent, if not informed consent, if they don't know that you're doing this in order to maintain your skills, it also does not extend to using the patient as a cadaver. We all want to maintain our skills. We all want to perform skills that we haven't performed before or that we rarely get to perform. And this may seem like a resuscitation of opportunity, but it is completely unethical. Your patient is either a candidate for resuscitation or they're not. And if you're unsure, then you proceed with the resuscitation. But unsure does not mean unsure.